When I first walked into a friend's living room and saw a wheelchair stuck at the edge of the couch, I realized the whole conversation about affordable home care equipment was about to get a lot more real. My friend was trying to help her dad, who's on the heavier side, move from the bed to a chair, and every time they tried, they ended up wrestling with the mattress, the floor, and a lot of frustration. That moment made me think about all the people who are stuck in that same spot, wondering whether a lift is worth the investment or just another piece of bulky furniture. Link is in the description if you want to check the product details on Amazon. The ProHeal sit-to-stand lift promises a 500-pound capacity for sling hooks and a design that's supposed to work both in a home setting and in a small clinic. That sounds impressive on paper, but the real question is, does it actually make the daily transfer routine less of a chore, or does it become a new set of problems to manage? I spent a couple of evenings watching a few unboxing videos, reading the specs, and scrolling through the handful of reviews that exist. The consensus is a solid 4.4 out of 5 stars from 63 people, which tells me most users aren't blowing it up, but they're also not shouting from the rooftops. So I dug a little deeper, thinking about the practical moments where a lift either shines or falls short. First off, let's talk about the setup. The unit arrives in a single crate. The frame is already assembled, and the 4 sling hooks are attached to a central bar. You'll need to position the lift near the bed or chair you plan to use it with, and that can be a bit of a dance. If the room is tight, you'll have to make sure there's at least a couple of feet of clearance on each side. Otherwise, the arm swing gets restricted, and you lose the smooth arc that's supposed to make the transfer painless. For a typical 2-bedroom house with a standard bedroom size, the footprint fits comfortably, but in a cramped apartment, the lift can feel like a permanent obstacle. What really matters is the actual transfer. The sling hooks attach to a sturdy fabric sling that wraps around the patient's torso and legs. You lower the sling, position the patient, then engage the motor to lift them up to a standing position. The motor's lift speed is moderate slow enough that it feels safe, but not so slow that you're watching the numbers tick for minutes. I noticed that the lift has a hold button that keeps the platform steady once the person is upright, which is a lifesaver for anyone who needs a moment to adjust or catch their breath before stepping onto a chair. If you're caring for someone who weighs close to the 500-pound limit, the lift does its job without wobbling. The frame feels robust, and the 4-point sling distribution spreads the load evenly, reducing the strain on any single point. That's a real benefit for heavier users because you'll often hear complaints about lifts that tip or sag when the weight is near the max rating. With this model, the motor doesn't strain, at least in the short runs I observed, so the battery or plug-in power source, depending on how you set it up, holds steady. Now, the strengths become clearer when you picture everyday scenarios. Imagine a caregiver who needs to move a patient from a low-profile hospital bed to a dining chair 3 meters away. The lift can be positioned, the sling hooked, and with one button pressed, the patient is gently raised and pivoted toward the chair. No more dragging the whole mattress or trying to hoist the person manually. For families with limited mobility assistance, that translates into fewer back injuries for the caregiver and a more dignified transfer for the patient. Another practical upside is the low maintenance. There are no complex hydraulic systems to bleed, no oil changes, and the motor is sealed. A quick wipe down of the frame and the sling after each use is enough to keep it looking fresh. The fact that the lift runs on a standard 110-volt outlet means you don't have to worry about swapping out batteries unless you plan to use it in a room without power. But the lift isn't without its trade-offs. The biggest one I saw in the videos and read about is the noise level. The motor hums louder than a typical bedroom fan, which can be startling for patients who are already anxious about transfers. If you're in a quiet home environment, you'll likely need to reassure the person that the sound is normal and not a sign of malfunction. It's not a deal breaker, but it's something to keep in mind if you're caring for someone with heightened sensory sensitivities. The sling itself, while strong, can be a bit tricky to position correctly the first few times. You have to make sure the straps are snug around the hips and shoulders without cutting off circulation. Some